Hello everyone, I'm Arya, your host, and welcome to today's live session. Today we'll be exploring and providing more information about the laser treatments, how they are used, if or not they are safe, and some do's and don'ts if you want to undergo any laser treatment. So stay with us till the end and comment down your questions below. We'll be answering them in this very live session. Before we begin, let me tell you, if you no longer want to continue difficult diets but want to reach that perfect health goal, well, we are here with our nutritional expert coaches who will be helping you with all of it. We have started a new diet consultation, which includes three different programs. First is the free assessment, another is the 3 week program, and we also have a 3 month program with dedicated coaches. Register today at www.eGlobalDoctors.com and book your appointment to get a proper nutritional coaching. We have with us today Dr. Manish Rijhwani. He's a senior consultant dermatologist in Jaipur. He has done his MBBS and MD from BJ Medical College, Ahmedabad. He has an experience of nearly 20 years in various fields of dermatology with special interest in lasers. During these years, he has worked at Ministry of Health, Kuwait for 15 years and is presently working as a consultant dermatologist and associate professor at Mahatma Gandhi Medical College and Hospital, Jaipur. He has worked extensively in dermatology, venereology, leprosy, dermatosurgery, and has specialized in skin laser treatment. Welcome to the live, Dr. Manish. A very good morning to you. How are you doing today?
Good morning, Arvind. Thank you so much. Thank you for such a kind introduction, and thank you for having me on this platform of eGlobalDoctors.
Thank you. So let us begin with our session with a very basic question about our topic today. What and how are lasers used in the field of dermatology?
See, lasers as such are a complex device. So in layperson term, it produces a controlled ray of very powerful light, which is used for various treatments. It is used in dermatology. It's also used in various other fields of medicine. So as such, the examples I'll give would be in other fields of medicine would be the whitening of teeth. They are using lasers for whitening of teeth. And I think everybody must have heard about the removal of specs with the lasers. They just do lasers on the eye to remove the specs. In dermatology, there's a long list of treatments that can be done, and aesthetic and cosmetic procedures where lasers can be used.
Wow, okay. So then what types of particularly skin conditions do these lasers treat?
See, it all depends on the diagnosis. So usually we divide into two parts. One is the therapeutic application of lasers. That is where lasers are used in skin diseases. Other part is the cosmetic one or the aesthetic one. So it's used to enhance the beauty of a person by treating the skin. So in the aesthetic part, the commonest laser that we are doing is the laser hair removal. Everybody must be knowing about this. So most of the females, they get lasers done for the removal of excessive hair growth over the body. Other is it's mainly used for the facial rejuvenation, for a youthful appearance. And then there's a long list of indications where the lasers are used for therapeutic purposes in the skin, mainly for the various birthmarks it's used. Other common indication is the tattoos. So tattoos, everybody is getting when they are putting up tattoos all over the body, and then when they don't like, they get it removed. So laser is the basic instrument or device that is used to remove tattoos also.
Correct. But while using the lasers for all these types of skin conditions, is the skin laser treatment safe? Like, does it expose us to any radiation?
No, as such, actually, the laser stands for light amplification by stimulated emission of radiation. So the word radiation in laser makes many people uncomfortable. As such, radiation means it is harmful, but it's a myth. Laser is very safe. It's not a radiation like the nuclear radiation or the gamma rays or the X-rays. These are very benign rays which are non-ionizing. They are similar to the heat. They are similar to the radio waves. They are similar to the light. So as such, if the diagnosis is proper, the lasers are perfectly chosen, and if the surgeon is experienced, then there are no chances as such of any complications if lasers are properly done.
Okay, so it would be safe if all these
Very
things
safe.
are taken into consideration.
Yes.
Okay, perfect. So I wanted to ask a common question, like, is there any age for these laser treatment? I would divide this question into two parts. Like, A would be, is there a particular age we should get it done before that XYZ age? And the B would be, is there an age after which we shouldn't go for the laser treatment?
Now again, I will say all depends on the diagnosis. So as such, lasers are safe from 1 month of age to 100 years of age. So it depends on the diagnosis what you are treating. Usually, for example, in a case of birthmark, so it's birthmark over the face, what we call is as the port wine stain. And such birthmarks should be treated as early as possible to get the best results. So usually we are starting at the age of 1 month. So 1 month infant can be exposed to the laser without any harm. All the precautions have to be taken, but then the results are there only if we start as soon as possible. And then it depends on the diagnosis, like in cases of hair removal, we can start as early as 14 years of age. And then there are so many indications in old age, like rejuvenation. These are the people who want to get the cosmetic lasers done. So wrinkle removal, rejuvenation. So that is being done at higher age group like 40s, 50s, 60s. And there are various tumor growths that takes place over the face that can be removed at any age. So it's from early age of 1 month to 100 years of age, it can be used. So it all depends on the treatment, what all diagnosis you have made and what all things you want to rectify.
Wow, I did not know that. So thank you so much for sharing it. Coming to the next question, if someone is having the acne problems or maybe rash or eczema per se, is it safe or good to have laser treatment for them?
Usually once any infection is active or acne, erythematous acne or active acne are there, better to avoid laser. Because once we laser such a patient, either eczema or infection or acne may spread all over the area where we have lased. So better to avoid lasers in case of infections, in case of active acne, or even in eczematous conditions. First we should treat these conditions and then go for laser. As such, there are no emergencies for laser surgery. So all indications you will see, all of them are non-emergent in dermatology. So first of all, we go for treatment of all these benign conditions, and once it's okay, then we go for lasers.
Okay, so it's better to avoid if you have any critical skin condition. So how long does it take for the skin after one has gone through the laser treatment? How long does it take for the skin to heal properly?
It again depends, as I said, on the lesion you are treating, the condition you are treating. So in case of the commonest one that I should say is hair removal, everybody must be knowing about the hair reduction laser. In this case, you will take just few days. It's about 4 to 5 days when the skin becomes normal. Initially, after the laser, it becomes little reddish and some edema is there around the hair follicles. It's like major goosebumps are there for a few days. And then within 3-4 days, the redness settles down and then the skin becomes normal with other supportive therapies like application of ice and everything, taking care of the skin properly. Then there are certain conditions like the full face rejuvenation. In that case, for rejuvenation, we are lasering the full face with carbon dioxide laser. In such cases, it takes 7 days to around 20-21 days for the skin to become normal. So it all depends on the condition that you are treating. So it's around 5 to 20 days it takes to get the skin back to normal.
Okay, absolutely. So to the audience watching, I just wanted to say that you can ask your dermatology or laser treatment related questions right in the comments, and we will have them answered by our expert, Dr. Manish. Moving to the next question, Doctor, can scars be removed by these laser treatments?
Now, this is one of the commonest indications that we are going for lasers. So there are various types of scars. The most common we are treating is the acne scars. So once acne is there and people, they don't get it treated properly, it leads to scarring. So that is the commonest indication. And there are various types of scars that we treat. The common ones are post-traumatic scars. After any sort of trauma, you get scarring. Post-burn scars, after the burn scars are there. And even post-surgical scars. Once you get the operation, you get that incisional scars and scars of the stitches.
Right.
These all scars can be treated with lasers. And we can get very good results if lasers are done properly at the early setup in cases of scarring.
Wow. Okay. So moving to the precautionary or caring type of question, what are some do's and don'ts before and after the laser treatment?
As I said, none of the indication is emergency. So it's not an emergency. We can prepare the patient for laser therapy, like in cases of hair removal. So we ask patient not to pluck the hair or not to go for bleaching, not to go for waxing. As we lose the chromophore once this is done. If this is done, we cannot go for laser hair removal. So you should take proper care for 1.5 months. That plucking should not be done, waxing should not be done. And then better to avoid the area from the sun. Sun protection is very important. If the skin is protected from the sun, then the complications are much less. In our type of skin, in Indian skin, the major complication is hyperpigmentation, that the skin becomes little darker after lasers. So if you protect the skin and we are applying sunscreens, we are taking good care of the region where we have to go for lasers, then the results are much better. And during the lasers, the only safety feature is to avoid any exposure to the eyes. So eye safety is most important. So while we are lasering, we just put the goggles. The doctors are putting goggles. The supporting staff is using the goggle. This is a specific goggle for each and every laser. Then for the patient, we cover the eyes properly with a metallic eye shield is there, so that the eye doesn't, the laser light doesn't go into the eyes. So this is the most important precaution during the procedure. We also try to keep the skin little cool so that there is no harm to the superficial part of the skin. After the laser, again, you have to take precautions. You should not scratch the place. It should not be irritated. And you should avoid the sun exposure again after the laser. All the instructions should be properly followed. And if there is no irritation, no sun exposure, infection should be taken care of. If there is any infection, the physician should be called as soon as possible so that it can be treated. So if all proper precautions are taken before, during, and after laser, the results would be excellent.
Right. So I have heard about this chemical peel technique by the use of which we can improve or smoothen the texture of the skin. So what is exactly the difference between this and lasers, and which one would be better?
See, again, it depends on the indication. So chemical peel, we apply certain chemicals over the face for mild exfoliation of the skin. So if the condition is like scarring is very superficial or the pigmentation is superficial, we can go for chemical peels. So lasers are a bit aggressive. So if the scarring is much more like the acne scarring, which is deep, the pigmentation is much more, then lasers, if properly done, definitely have better results than chemical peel. So it all depends on the indication, the condition, the expertise of the operating surgeon. So if properly chosen, both have good results, but when to do which is very important.
Right. So then how about the removal of ingrown hair? Does laser remove the ingrown hair?
About ingrown hair, I think this is the treatment of choice. So ingrown hair as such are the hairs which grow out and then they are curved. Usually it is found in the Indo-African population or the African region where the hairs, they grow out and then they again, because of the curve, they again irritate the skin, which leads to bumps and papular lesions. Usually males have over the beard area, those who are shaving regularly. So the culprit is the hair. So if we go for the hair removal in such a case, it's a 100% treatment in such cases. As such, there are no other treatments available for ingrown hair. So this is the treatment of choice. So here reduction should be done in such cases as soon as possible to get rid of this condition.
Okay, right. So then is this laser treatment permanent? Like if the laser hair removal is done, is it permanent?
See, before we used to say that we are going for laser hair removal. So now we have changed the name to laser hair reduction. So it's permanent, but now we are not able to get rid of 100% of hairs. So usually we say that every sitting we get rid of 60% of hairs. 40 they regrow. So again in next sitting 60% of the 40% will go. So around 6 to 8 sittings we are able to get rid of majority of hair, and rest of the hair they become little thinner and they lose their color, so they are not that visible.
Oh, okay.
So another important thing is the background of hypertrichosis or hirsutism, what we call it, excessive hair growth in a male pattern. So what is the reason for that? That should be investigated. So if there is hormonal imbalance in such a female, better to go for hormonal assay to find out the cause of this hair growth. And then if the hormones are altered or imbalanced, better to take opinion from an endocrinologist. Laser can be started simultaneously, but the treatment is also important. So treating the cause of this hypertrichosis or hirsutism is important. So if there is no cause and we are doing regularly laser for 6 to 8 sittings, the results are excellent. And even if there is regrowth, we can go for maintenance laser every 3 to 6 months.
Okay, got it. So one question which I want you to address, if anyone has it in mind, is laser treatment cancerous?
Yeah, this is a big myth as such because of the radiation, as I said, the laser term contains radiation. So radiation, everybody thinks that it's a dangerous radiation. So as such, it is a non-ionizing, what we call is a very safe radiation, like the heat, like the light. So as such, there are no complications of cancer with lasers. Although it's on the contrary, we are doing lasers for the removal of cancer tumors. So facial cancer, if you have, we can remove with the laser. Such tumors can be removed, such growths can be removed. So there are no chances of cancers with laser. Even a pregnant female can go for laser therapy, or a pregnant staff can work in the laser setup. Usually we don't recommend as such because of the medical legal issues, and there is no emergency as such for the laser therapy in anybody, but it's very safe.
Okay, perfect. So you mentioned about the complications. So I would want to ask, like, what are the other health complications you might get if you undergo the laser treatment?
See, as such, lasers are very safe if done by a qualified dermatologist, if the diagnosis is proper, if the laser is proper. So it's very important to diagnose first, then to choose the appropriate laser, and it all depends on the experience of the operating surgeon. So if all this is perfect, the chances of complications are almost nil. But although we see few complications because of the exposure to the sun, because of the skin type, each and everybody has a different skin type. So the complication, the major complication that we see is dyspigmentation. So pigmentation either increases, or if done aggressively, the pigment may decrease a bit. So all this with time they get settled down. Other complication is scarring. If done aggressively, it may lead to scars. So proper training is required, proper diagnosis is required, proper selection of laser is required. The other one is infection. Sometimes if the patient doesn't take care of the region where we have done laser, there may be infection. So if he consults the dermatologist, it can be easily treated. The dreaded complication is the eye complication. That is during the laser surgery. So eye should be protected, as I already said. The physicians, they are wearing particular goggles. These are specific for every laser. And for the patient, we are putting this eye shield. So if all precautions are taken as such, there will be no complications at all.
Correct. So we have a few questions from our audience. Someone is asking, are there any chances of getting any kind of infections after the treatment?
Yeah, chances of infection are there. So if proper post-operative care is not done, if that region is not taken care of, it is exposed to the sun, if it is scratched, because initially there may be some itching till the healing takes place. So post-operatively, few things should be taken care of. Ideally, the area should not be exposed to the sun. Usually for a few days, we should not put any makeup. We should not go for any hot baths. We should avoid swimming. We should wear very light cotton clothes so that there is no friction. We should not abrade the region. We should not scratch the region. So all the precautions, usually we give a paper with post-operative precautions to the patient so that she can have the paper with him or her and can go. If she directly follows the instruction, the chances of infection are almost nil.
Okay.
And
I hope
if
you got
infection is there, we can go for the treatment. Nothing to worry about the infection.
okay. Right. So hope you got your answer. If you take proper precautions, there is no chance of getting any infections after the treatment. So we do have one more question. I see. Does laser hair removal hurt?
It all depends on the patient. Some patients, they are a bit sensitive. They will think that there is some pain, because in cases of hair removal, we are not anesthetizing the skin. Usually we avoid putting there are certain creams which applied for half an hour or 1 hour, it numbs the skin. Then we can go for laser hair removal without any sort of pain. But usually avoid putting, because we want to know the pain intensity in the patient. We have to increase the dose or fluence of the laser till the patient feels some pain. So we have to follow the patient. If there is some pain, we have to decrease the fluence at such. Because if the skin is numb, we will not be able to know the highest fluence that the patient can tolerate. So we want patient to respond to us. Otherwise, if too painful, we can put the numbing cream and then we can go for lasers. We are especially talking about the laser hair removal. For other lasers, we are going for anesthesia, for removing for acne scarring or for removing tumors or even for tattoos. We numb the area and then we go for the laser so that there is no pain at all.
Okay.
So it all depends on the condition we are treating. At conditions where we want anesthesia, we go for anesthesia. Other conditions, we want the patient to respond to us, then we avoid anesthesia. Especially for the laser hair reduction, we don't go for any anesthesia.
Okay, great. So coming to our last question here, are there any restrictions for yourself, maybe related to the food or the physical activity after you have undergone the laser treatment?
Yeah, about the food, I don't think any restrictions on the food items are there. Mainly post-laser, the restrictions mainly are the avoidance of exposure to the sun. As I already mentioned, one should not prick the area, one should take proper care of the area. If there is redness, one can apply ice packs for some time. One should not scratch the area, prick the area. One should not go for hot bath, or one should not go for swimming for a few days. And one should wear light cotton clothes so that the area is not irritated. So all these simple precautions, if done, would give excellent result.
Absolutely. So I just want to tell our audience, if you are Indian origin living in US and if your parents are visiting from India, you do not need to worry about their medical need in US. eGlobalDoctors have your back. We have different packages for you starting from $199, and they provide access to 300 plus doctors from USA and India. With 30 plus specialties, prescription will be provided and we get back to you within 1 to 3 days of time. Family members can participate live via video physician consultation from any part of the world, and video consultation is about 30 minutes. So register yourself at eglobaldoctors.com and book your consultation now. So let me check if we have any more questions. I don't see any. So yeah, I think so with that. Thank you so much, Dr. Manish, for taking time from your busy schedule and contributing to a valuable session for the laser treatment. It was very informative, and I'm sure it must have cleared so many questions from everyone watching this live. So before we end this session, can you bust a major myth related to the lasers for our viewers and listeners today?
Most important that I want to stress is the myth of cancer. So radiation or laser causes cancer. So it's a big myth, and lasers are absolutely safe if done by a proper trained, experienced laser surgeon. So nothing to worry about laser. Everybody can go for laser treatment with all precautions pre and post, and especially the eye care. That is the most important one that I still want to emphasize during the laser treatment. Eye safety is the most important.
Right. So thank you so much. Thank you so much for this live. Hope to see you soon with another interesting topic for our live. Till then, take care and have a wonderful day ahead.
Thank you so much. Same to you.